You know, it's a wild thought, but have you ever considered that a serious chronic lung disease could come from something you run into every single day? Something that's in your garden soil, or maybe even in the water from your kitchen tap? Well, today, we're going to decode a hidden illness that starts in those very places. Okay, let's really think about this question. I know it sounds like something out of a science fiction movie, but for a growing number of people, this is their reality. We're talking about a group of organisms that are literally all around us, but for just the right person, they can set up shop in the lungs and cause years and years of trouble. So meet the culprit, Nontuberculous Mycobacteria, or just NTM for short. Now, these aren't some rare exotic germs. Nope, they're everywhere. There are over 200 different species found in our environment. And while, most of them are totally harmless, a few can get into our respiratory system and lead to a really persistent and challenging lung disease. Now here's the thing. NTM isn't contagious. Thankfully, you can't catch it from another person. But the number of cases, it's clearly on the rise. I mean, just look at this. In the US alone, the rate nearly doubled in just 7 years. It's especially hitting women and people over 65. This is quickly becoming a pretty significant global health concern. So to really get a handle on this disease, we first have to understand the organism itself. Let's start by taking a closer look at these everywhere bacteria. Okay, so if you've got this super common bacteria causing some really uncommon symptoms, how in the world do doctors even start to figure it out? That brings us right to section 2, solving the diagnosis puzzle. Well, it turns out it's not a simple guess. There's a very strict 3-part framework they have to follow. A doctor can't just make a diagnosis based on one piece of evidence. They need all 3. First, the patient's symptoms, things like a cough that just won't quit or fatigue. Second, they need to see specific patterns on a CT scan of the lungs. And third, they have to actually grow the bacteria from at least 2 separate lab samples. It's a real medical detective story. So let's zoom in on that second key, the radiology. This is where we get the visual proof by basically learning how to read the map of damage that the bacteria leaves behind in the lungs. Radiologists are on the lookout for 2 main fingerprints. The most common one is called nodular bronchiectatic disease. You can think of it as a slow burn. It progresses really gradually. The other one, fibrocavitary, is not as common, but it's way more aggressive. So let's take a look at what these actually look like. And this is a fantastic way to picture the first major clue for that common form of NTM. Look at the CT scan on the left. You see those circular shapes? That's an airway, or bronchus, that's become permanently widened, and it's sitting right next to its buddy, the artery. Together, they look just like the signet ring on the right. This is actually called the signet ring sign, and it's a classic hallmark of airway damage called bronchiectasis. The second clue is just as easy to remember. On this scan, you can see all these tiny branching lines and little dots. Radiologists have a great name for this, the tree in bud pattern. Why? Because it looks exactly like the tips of tree branches that are just starting to bud. This tells us there's inflammation and gunk deep inside the tiniest airways. Okay, now let's switch gears to that second, more aggressive fingerprint. This is the fibrocavitary pattern. You can immediately see the difference, right? Instead of small nodules and little branches, we're seeing large, destructive cavities, actual holes forming in the upper parts of the lungs. This type tends to show up in patients who already have other lung conditions, like COPD, and it definitely carries a more serious prognosis. So once a doctor identifies NTM on that map of the lungs, the job isn't done, not by a long shot. The next question is absolutely crucial. Is this getting worse? This brings us to gauging the disease's course. So the big question for the whole clinical team is all about the trajectory. Is the damage we're seeing on these scans stable? Is it kind of flaring up and then settling down? Or is it progressing on a slow but steady march forward? This slide is incredibly powerful. Just look at this. You are looking at CT scans from the exact same patient, but they're taken over 8 years. In 2015, you can see the disease is there, but it's pretty mild. Fast forward to 2021, and you can clearly see more damage, more of those widened airways. And then by 2023, wow, the disease has clearly progressed, with a lot of damage and scarring. This visual timeline is exactly what doctors use to decide when it's time to start the long and difficult treatment. But why? Why does it get worse like this? Well, this quote kind of explains the biology behind it all. There's a concept called Cole's vicious cycle. Basically, the first infection causes inflammation, which damages the airways. That damage makes it harder for the lungs to clear out mucus. So the mucus gets stuck, which leads to more infection, which leads to more inflammation. It's a self-perpetuating cycle of lung destruction. So as doctors are tracking this progression over time, they're on high alert for specific danger signs. The development of cavities, those hollow spaces we saw a minute ago, that's a major red flag. Same with something called bronchopleural fistulae, which are basically abnormal tunnels that can form. Seeing these things tells the doctor that the disease might be shifting into a higher, more aggressive gear. And here is a really striking example of one of those danger signs. Just look at that large, dark, hollowed-out area in the patient's right lung. That is a cavity. When a radiologist sees this develop in a patient with NTM, it often means a more aggressive treatment is needed, sometimes even surgery, to get the disease under control. And finally, this brings us to the last piece of the puzzle: the challenges that can make diagnosis and treatment so tricky, including diseases that look remarkably similar. And this brings up the single biggest question for doctors looking at these scans, the real elephant in the room. Is this NTM? Or could it be its more famous and more contagious cousin, tuberculosis? Just take a look at these two scans side by side. On the left, we've got the fibrocavitary form of NTM. On the right, we've got tuberculosis. The patterns of these holes, these cavities in the upper part of the lungs, they're incredibly similar. I mean, you can't tell them apart just by looking at the picture. And this is exactly why that three-part diagnosis we talked about, symptoms, imaging, and the lab cultures, is absolutely essential to get it right. So here's why this all matters. A CT scan for a patient with NTM is never just a static picture. It's a dynamic story that's unfolding over time. It's the tool that helps doctors confirm the diagnosis in the first place, figure out how severe it is, track that slow progression, and ultimately, it helps doctors and patients make those huge, life-altering decisions about when and how to treat this hidden disease. Which leaves us with one last really fascinating question. We know the bacteria are everywhere. They're in our water, they're in our soil. So why do some people get this devastating disease while the vast majority of us walk around totally fine? What is it about their bodies or their immune systems that makes them uniquely vulnerable? Well, that is the next chapter in this incredible medical mystery.